guys. So we're going to move into a great panel discussion on side effect management. We have Megara Walsh, who is a nurse, who'll be walking us through some of the information. And we have two patient panelists as well, Sean Healy and Michelle Piccolo, who wasn't able to necessarily jump on with us. We're not sure if she'll be joining us a little later today, but trust me, Sean's going to be able to handle this. I have faith in him. So I'm going to turn it over to them. Please don't forget to put any questions you have in the chat.
Okay. So good morning, everyone. My name is Megara Walsh. I am a nurse in the GU department at Dana-Farber Cancer Institute in Boston, Massachusetts. And I have worked in the GU department for the past 11 years, where I have primarily focused on working with patients who have kidney cancer. And I am really excited to be here today to talk about side effects management. It's one of the biggest topics that comes up and one of the most important, certainly. You know, when patients are diagnosed like yourselves and have a new diagnosis, find out they need treatment or a procedure or some combination of the two, you know, the first questions that often come up are, what are the risks? What are the side effects? How is that going to make me feel? And it's critical that other healthcare professionals, such as myself, do a good job at effectively educating patients and caregivers about those risks, and, you know, continue throughout treatment or after to monitor and make sure we provide a good support system to allow patients to recognize symptoms or side effects as they come up, and also how to treat them, what to do about them. And, you know, that provides an environment that, you know, patients can have a successful treatment experience. So it's really important to get the patient perspective, and that will allow us to do a better job. So happy to be here today. First, I just want to kind of jump into a little bit of an overview of what are side effects, okay? So per the FDA, a side effect is going to be an unwanted or undesirable effect that is at least possibly related to medication or treatment, an effect that is secondary to the intended one, okay? And so this can be from systemic treatment, which would be, you know, medication that goes throughout your body. It's either going to be oral pills, IV, or it could be a side effect of localized treatment, which would be something like surgery or radiation. And, you know, an example of that would be, we had surgery. The intention was to remove a tumor, but the unintended effect would be pain and constipation developed. Side effects can be subjective or objective. So subjective, things like fatigue or pain. These are things that your healthcare providers can't see. We are reliant upon your feedback to help determine how severe they are and how much they're impacting your day-to-day quality of life. So you might hear people say, is the fatigue tolerable or intolerable? And this would be, you know, variable from person to person. Everyone can tolerate different things, and there are different parts of, you know, their lives, and that really impacts what we do with treatment or what we need to do. Objective side effects would be things that we can clearly see, such as we take your blood pressure, it's elevated, we can tell it's elevated, or we check labs and we can clearly see that the potassium level is off. These are very objective, black and white type of side effects. Side effects sometimes you can't even feel. You may be completely asymptomatic, and we look at labs, for example, and can tell you might be a little bit more anemic, meaning your red blood cells are a little bit lower. You might feel the same, which is great, but we might notice it on the lab values, or it could be anywhere from mild to severe, or unfortunately, it's sometimes life-threatening. So it runs a full spectrum. Okay, next slide, please. Why and how do we monitor side effects? The overarching reason we monitor side effects certainly is for safety reasons. Always do no harm. That's the mantra of healthcare in general. We need to make sure that we can safely administer treatment or do an intervention without hurting you. And this is the same whether you're receiving standard of care treatment or whether you're on a clinical trial. We want to increase tolerability, improve quality of life. So yes, there may be a whole host of side effects with everything that we're giving with you to treat your cancer. However, for every side effect, there's generally a lot of things we can do to help mitigate these things. And the more you're in communication with your healthcare team, the more we can intervene quickly and do something about them. So we're monitoring you not just on day one of treatment, but every day that you're continuing on to make sure that things are going okay and to help step in when we need to. Promote therapeutic effect. So what do we mean by that? So if you're taking a medication, but you're not tolerating it and we don't know, we may have to hold the treatment or temporarily stop it because it's not safe to continue it due to the side effects. But if we're monitoring and if we're in communication with each other and we're able to step in and do one of several things to help you tolerate the treatment better, that means that you're going to be able to stay on the treatment longer and be more successful with that. Learn about safety profile of investigational treatments or interventions. So if you're on a clinical trial, you may be receiving a drug that is brand new, or you may be receiving a drug or a combination of drugs that are not new to us, but the combination is, or we're using the drugs in a different setting. And it's very important to learn about the safety profile of these things. Is the treatment safe? Is the combination of it safe? Are they going to exacerbate side effects that we already know about? So it's very important to advance treatments and make sure that we are doing it in a safe way. On trials, for the same reasons, we need to generate and provide safety reports. So that's how we disseminate these risks to healthcare professionals, physicians, researchers all over the world when we're using new treatments. And that allows us to build a safety profile. Find the correct dose. So sometimes if you're on an early phase of a clinical trial, we don't know what the correct dose is, and we use the side effects often as a guide. We try to find the maximum tolerated dose. So that might be something you'll hear if you're on an early phase clinical trial. How do we monitor side effects? So a whole variety of ways. We check labs, right? So every time you come in for your visit, oftentimes you're going to be having labs and we're checking your blood work. We're checking vital signs, things like blood pressure, heart rate, oxygen saturation. We see you in clinic probably a lot. I know we do in my practice, and I'm sure it's the same elsewhere. We have physical exams. We have times where you can meet with your doctor or healthcare team to talk about how you're doing. Sometimes we need to use imaging, things like CT scans, ultrasounds, MRIs. If we have a concern and we need to get a CT of your chest to make sure there's no inflammation in your lungs, for example, that's when we might order some imaging. Interim phone calls. So you might be hearing from a nurse or a member of the healthcare team, just checking in with you. And we know you started treatment, for example, last week. How are things going so far? Questionnaires. I know it's not uncommon if you're on a trial or off trial to have to answer a whole series of questions about your health, how you're doing on a day-to-day basis. And this can help kind of start a conversation or facilitate conversations during your visits to focus in on areas where you may be having some trouble. If you're on a trial, again, you will often hear providers talk about, oh, this is considered grade 1, grade 2, grade 3. And you're like, what's that? So there is a system of grading adverse events that we can use to help determine the severity. For example, if you have diarrhea, for example, they'll have a certain amount of times over what is normal for you. And we'll be talking about that during your visit and referring to this grading system to determine the severity. Okay, next slide. What can we do to manage these side effects? So a lot. And what I like to tell people is that earlier, the better. So people sometimes say, oh, I don't want to bother you, but it is absolutely no bother. That's what people like myself are here for. And the earlier we do something about it, often the better the outcome. It's much easier to nip something in the bud, so to speak, as opposed to playing catch up. Things that we might do would include medication. So we can prescribe things for nausea, or we can optimize antihypertensives or blood pressure medications to enable you to stay on treatment with a quality of life or in a safe manner. supportive self-care. So things like exercise. We know that there are studies that show that exercise is oftentimes the best way to combat treatment-related fatigue, for example. Diet, we have teams of nutritionists who can help. Hydration, things like staying moisturized for your skin, or knowing your body, knowing when to rest, and just taking good care of yourself. Dose changes as well. So sometimes we need to delay the start of treatment. So if you're in for a new cycle of something like immunotherapy, we might say, okay, we need to delay the start of this to help monitor how things are going to keep you safe. Interruption. Sometimes we need to take breaks, and that happens all the time. Treatment is a marathon, not a sprint, we like to say. So just knowing from the get-go that sometimes these things happen and it's a normal part of treatment is, I think, important to convey to patients, because I don't want people feeling if they have to hold, then their cancer is not being treated, or they're going to have to come off altogether. That's not necessarily the case. Sometimes a brief break to reset things does a lot of good and helps people stay on treatment longer. Sometimes we need to reduce the dose. That happens all the time as well. And we like to tell people at the beginning, we start at this dose, everyone requires a different dose. If side effects become intolerable or become a safety concern, we may need to make adjustments. So modifying treatment, delaying treatment, there's so much we can do to provide an environment that's conducive to treating the cancer and maintaining quality of life. Okay, next slide, please. How to find out about possible side effects. So if you're on a clinical trial, you might get a very lengthy consent form. So there are risks in there. They tend to be quite verbose and list everything possible. So while they're in there, it could be sometimes overwhelming, but they're listed. If you are going on a trial, I suggest, going over the consent form with a family member, with your physician, with the research nurse. Make sure you have an understanding and have an opportunity to talk about these things together. Teaching handouts like drug sheets, you may get these from your nurse. There are also a wealth of information on the internet. So the KCA, we have drug teaching sheets available on our website. The drug manufacturer, so if you know who makes a drug, you can ask if you're unsure. You can go on their website, like Pfizer, for example, and they have patient information with teaching sheets that has information in written format that can be helpful to refer to or reference. But I always want to say, if you're reading anything and want to know more about it, you're not sure you're experiencing it, always reach out to your care team. That leads us into discussion with the medical team. So that's really important, is just kind of recognizing or identifying who's on your team. Who do you go to? Okay, next slide, please. And this is an example. So you're going to have your physician, your oncologist or surgeon, radiation oncologist. Then there are the mid-level providers, physician assistants, nurse practitioners. There's the nurses, often called nurse navigators or program nurses. If you're on a trial, it'll be a research nurse. If you're on a trial again, you might have clinical research coordinators who often assist with the logistics of treatment. This is an example. It might vary a little bit from site to site, but however your site operates, you want to identify who your team is and get their contact information so that you can start to build this relationship. Okay, so that was a lot, but things that we want to discuss is, I know in my practice, when someone comes in for day one, I kind of go through the spiel of information. Here's the treatment, here are the side effects, here's our contact information. And oftentimes, when someone's starting a new treatment or their caregivers and their patients are looking at me seemingly overwhelmed, I never know, how much is too much, when to push forward, when to pull back, and I would love to know more, and Sean will be helpful here, what works, what doesn't, what does your team do that you find effective, or alternatively, what are things that we should know that, might not be as helpful for the patient? Do you have anything, Sean?
Oh, sorry, that was a question for me. I'm sorry. Yeah, apologize. I was
That's okay
by your thoughts. No, I mean, I can, first of all, a lot of the things you're saying really resonate with me. Starting the targeted treatment that I'm on last summer, I had a lot of questions, but the thing that I think is really important is emphasized, and probably I didn't do as well as I could have, is this whole like constant communication on what's going on. If anything, I had a few times I'm like, well, this has been going on for a couple of weeks. So like, that would have been good for tell us 10 days ago that's what's going on. We could have maybe suggested some things and stuff like that. So certainly the open communication and talking about those things and just what's going on, this is super important.
Mm-hmm. Yeah. Is there any particular method that you find more effective when it comes to learning about side effects? Is it more helpful to hear about it? Do you like the written handouts?
Yeah, good question. Both I and my wife went through a lot of stuff when we made the decision to start taking my axitinib that I'm on Inlyta. It first started with my doctor. I mean, certainly my oncologist that I work with, he was like, hey, here's it is, and here's the long laundry list of things that could be side effects. The key thing we talked about, he's like, here's all the things that could happen. It'll probably be 1, 2, or 3 of those, and they're all typically tend to be very manageable. And here's how. And so it was more, here's what to anticipate, but every person's different, and you're going to take. And so it started with a conversation at first. We did do, to your point, axitinib is made by Pfizer. Pfizer has a lot of information. In fact, when I was getting on, I got a very big binder from them talking about all the things and stuff. So some good written stuff there. And in some forums I'm out there, I kind of went and looked around and see what other people took it and see what did they experience and things like that as well. So, a few different perspectives, both from the drug manufacturer, from my doctor, and then other people who have gone through this as patients, just to kind of know what to expect, but also knew, well, we'll have to start taking it and see what happens, kind of thing. So.
Right. Yeah, absolutely. And then there was a question that came in from the group outside. How can patients find out information on if side effects may resolve over time, like after immunotherapy, for example? As it can be hard to search out in the internet and the guidelines might vary. So that's very true. There's a lot of information out there on the internet, and as a patient, it can be hard to interpret, but that's where your care team comes in. So, if you feel like you have a side effect, I would encourage you to talk with your physician, your nurse, the people who have experience with things like immunotherapy. Also, I know we have to reach out to our specialists a lot for immunotherapy toxicities. So, for example, if you've experienced something like colitis, for example, we often bring in our GI colleagues who can help manage these things with us and speak to what side effects are expected to resolve, and some that may be more of a new chronic thing, such as adrenal insufficiency, for example. That's something that you would work with your healthcare team and a specialist like an endocrinologist on. And if you're finding that you're not getting the information that you need back, I would encourage you to communicate that and say, I need more information on this, and I want to know how this is going to impact me. And, ask for referrals to specialists who are familiar with it in the particular area of concern that you're experiencing. Let's see. One more thing here is, can doctors share studies with patients or help direct them to ones that may give some data? So, yes. So the studies or the clinical trials that are resulted and published certainly are out there and can be discussed. Oftentimes when patients are enrolled in clinical trials, the trial is ongoing and the information, is still in process. We might have some anecdotal information based on patients who we've treated and what we've seen, but it's not something that we can generalize to the entire population of patients. And, until the study is fully accrued or there's some type of official analysis, we really don't have that information to be able to broadly share with you. And one more, would dosage be reduced would it affect overall survival? So that is something that, of course, you have to discuss with your physician and healthcare teams when and if it comes up, about how they think it would impact you. However, we always measure when we're reducing a dose, what is the risk benefit here? And we need to make sure we're not harming you. So if we stay on a dose that is too high or producing side effects that could do harm, then that's not good for the overall plan. When we do treatment, we want to make sure we're doing it to help you live longer and better. And so we want to make sure that we're staying on track with that. Another thing is that if the dose is too high to a point where you can't tolerate it and are constantly needing to hold it, then sometimes holding it briefly, letting the toxicity resolve a bit, and then going on a reduced dose helps you stay on the treatment longer. And therefore, you're actually going to be getting more treatment than if you had stayed on the higher dose that you couldn't tolerate. So sometimes hanging on and trying to hang on to that higher dose can do more harm than good for your overall treatment plan. Let's see. Sean, are there any information about side effects that you wish you knew before?
Yeah, in retrospect, it's easy, I think, to say, gosh, I wish I had known that. I guess when I started, I felt like I asked a lot of questions, and per, my said a few minutes ago, we did a lot of reading and asking things, but just to share, like when I started it, I had a number of side effects pretty quickly that showed up. Some of them pretty expected. So one, my blood pressure went up considerably, which was not uncommon for it. So we knew that. And so that was more just like get that under control. I also had really, really bad heartburn, which I'd never had in my entire life. And it was awful. I remember I couldn't sleep and stuff. And someone's like, oh, you have heartburn. And so I went on Nexium to take care of that. And so that was fine. So at first it was fine. And then things kind of calmed down. I think got to the point I'm like, oh, I actually was just kind of accepting of them. And there was a couple times when I would have my regular check-in. So with my oncologist up, I go in for scans every 3 months, and basically 6 weeks in between, I also then have a virtual visit with them, and they'll run through like, are you having any of these things? A lot of times like, no. But I had, for example, one of the things that's not uncommon is like you can get foot or hand sores, and the PA asked me, she's like, how about your feet and your hands? And I'm like, oh my gosh, my feet have been really bugging me. And I hadn't even thought about it. And I'm a hiker and I hike a lot. I was just like, oh, maybe I'm just sore from doing a lot of hiking. And I'm literally like, oh no, I have these sores all over my feet. And that's what's bothering me. And it was kind of like, wow, being more observant, I think, is probably just sometimes. And again, I wasn't suffering by any stretch of the imagination, but it was one of those ones where just being really like, is this a side effect or not? And what I think what you said is like, I think your medical team is always going to tell us what's going on. It might be something, or maybe it's not. And so I think knowing, just maybe being even more sensitive to things, but I'm kind of somebody who doesn't like to complain. So I think, but this is a case where they're like, look, share what's going on. So I think just knowing that is it. The other thing I think it was good to know, you mentioned this obviously on holds and things like that. The medication I'm on, they, while my doctors want me to take it pretty regularly, they're like, look, you can take a day off or two. It's not a big deal. And if you're not feeling great, or you're traveling and you don't want to have to worry about having diarrhea or whatever else, like take a couple of days off and that's fine. And I think they mentioned that at first, but now has become like, look, if you don't want to take it on a Friday and Saturday, that's fine. Mm-hmm. It's back to your point around, this is a marathon. You're going to probably be on this for years. Like taking a day or two off is not going to make a difference. And so that's a really nice thing, because it does, again, my side effects are pretty under control and I can manage all of them, but there's some days that I'd rather not have to worry about some of the stuff that can come up, so it's just been good to know that. But that's been something that's kind of come over time, but continue, again, just having open dialogue with my medical team about what's going on and things.
Mm-hmm. And do you track side effects in a certain way at home?
I do. I kind of have a little like journal on my phone where I go, hey, today was a good day or it wasn't, and here's what. Just mostly because it enables the conversations when I do have them with medical team. But like, well, how often are you having diarrhea, or how often are you finding that the sores on your feet do this, and and just having them like, well, in the last month it was this much, right, kind of thing. So I do keep an eye on it from that standpoint, mostly to be able to have a good fact-based conversation with my team.
Yeah, that's definitely definitely helpful. I think from the other side of things, we say, okay, how you been doing? And people are like, oh, I have questions, things have come up, I forget them now. So sometimes, keeping a journal or something like that to track things, it can help serve as a reminder. Oh, this is something I want to talk about at my next visit. Or, blood pressure, for example, a lot of times people's blood pressure is much higher in the visit, but if we don't know what it's been at home, so sometimes keeping a log of blood pressure or reminders of how you've been feeling on a daily basis can help guide important conversations in the right direction and help elicit the information that's so important to kind of guiding and making those decisions on treatment. So that sounds like, from your perspective as well, like keeping track of it in some type of journal form might be a good idea. Okay, let's see. So a question came in. Do either of you have suggestions about talking with your non-cancer team about side effects, or should you talk to your, urologist or oncologist specifically about side effects pertaining to anything related to the cancer diagnosis? And I know my input for that would be that I think it's important to develop a whole team around you. Sean, I see if you agree as well, but the more people involved in your care team, usually the better. You want your primary care physician is very important, because they may be closer to you and they're managing things on a daily basis that we can help work as a team together. They might not have as much experience, pertaining to specific things about the cancer or the treatment. So you always want to make sure that your care team is involved. But other specialists or doctors that are involved in your everyday care, I would say that it's very important to keep them in the loop and up to date. And you can ask your care team to make sure they're sending the records or being in touch with your team of providers. Do you have that, Sean? Do you talk to your primary care, or how do you stay in loop with your other doctors?
Yeah, I did. It's actually, I think it's a great point. My since I was diagnosed coming up on 4 years ago, and well, obviously I have my surgeon and I have my oncologist that I work with. Like I regularly let my primary care physician, like, hey, here's what's the latest is. And as I've also had a couple recurrences. And so it's more like, hey, excuse me, here's the latest, here's what's going on. And he's always there like, well, let me know. And then, I regularly go in for regular checkups and things like that too. So it's just good to go like, okay, what's the latest and what are you on? To your point, I'll say this, he's regularly the first one to tell me, he's like, that medication you're on, I've never heard of that and will likely never have another patient in my life who's on that. It's kind of a unique thing. And I said, yeah. And so, but he's like, he acknowledges that. He's like, but I know we're watching he's like, we're watching obviously your blood pressure and stuff like that. So he's actually the one who, for example, keeps an eye on my blood pressure medication. So that's kind of a partnership where my oncologist is like, you have a primary care physician, go with them for that, but and to manage and stuff. So he's tied into what's going on, and therefore we can have good conversations. But he also, there's a line, he's like, you need to talk to your friends about that stuff, but I can help you with this. Yeah. So
yeah. And then, I think this comes up a lot on a day-to-day basis is, there's sometimes some hesitancy for patients to report side effects. And I'm curious, to hear from patients what they are. From what I've heard, it could be, you're afraid of having to stop the medication, or you don't want to bother anyone, or you weren't sure if it was related anyhow. Do you have suggestions, Sean, about ways to contact your team and like a good way of describing side effects, how severe they are, and what you're experiencing?
Yeah. I mean, I think this goes back to, again, when I started this medication, they encouraged me that, look, tell us about anything. And they're like, even just drop us a note saying things are going fine. So by the way, I use so my chart, like, I mean, I most of the time my communication with the team is like, just I'll send them a note, like if it's like, hey, I'm having this kind of bad things. And a lot of times what that'll turn into is I'll get a phone call then from one of the nurses or stuff, just go, hey, we want to ask a few more questions. the thing that, and Megara, you might have this. I know what I find is I feel like I've been pretty detailed, and then they'll call and ask me a lot more questions, which I'm like, obviously I wasn't detailed enough on what I'm experiencing, because they'll like, let me ask a few more things. I'm like, oh, gotcha. And so a lot of times I think back to the journal and stuff, I think being really just observant and then being able to communicate that with them. But I find that's usually the best case. And a lot of times, I'd say at first when I started the medication, it was much more common they would call me and talk to me live because they just wanted to hear things. And now it's just because it's been going, pretty well and been able to kind of work through the side effect. It tends to be more of a message back and forth kind of stuff. So.
And our frequent phone calls phone calls from your care team to discuss like how you're doing, are those helpful, and asking like specific questions maybe about side effects, and be like, oh, like you said, the hand foot, maybe that was discussed at the beginning, maybe it wasn't, but is it helpful to hear from people and asking specific questions like how are your feet, or what are you, or like kind of starting some questions about common side effects that can help jog that? Is that, do you find that to be helpful?
I do. I mean, and every time I have, and I actually literally just had my it's kind of 6-week check-in, virtual check-in yesterday. And it's actually really helpful because they regularly do a good job. Like, let me ask all the common things that and obviously they go, we know you've been having this and this. How is that going? They're like, how about this? And they'll go down the list of things. And every once in a while, you sure you're not having this? And it's just I think it's back to it's a good reminder of like, hey, sometimes you'll have side effects that then go away, and then you'll have new ones that come later, right? I think that's the other thing. So it's not static, right? It can change, and so just being a reminder, like, what does that, and be observant. Particularly for me, because I tend not to be a complainer. So just saying like, hey, are you even noticing this? Is like, oh wow, am I? And it actually just makes me think. So I appreciate that. And again, a lot of it's for the right reasons too. They're like, we can probably help you with that. Like,
right.
Like don't gut something out that we can, maybe there's something we can do to make your back to quality of life. So you don't have something that's annoying. Like we can probably, there might be a way to address that. So.
Exactly. That's another, you keep saying, I've said this phrase a few times, which I hear all the time is, I'm not a complainer. I don't want to complain. And believe me, when you're reporting side effects or how you're feeling, it's not complaining, right? And just like your care team reiterated, is that if you report them to us, there are going to be things that we can do to help mitigate these symptoms, or at least make them as tolerable as possible. And that can certainly, make you feel better. And it's easier to do as soon as they're coming up, as opposed to, it's already now so advanced that we're going to have to hold treatment, and probably for longer. So the sooner we know, the better. And, that brings me to a question that came in from the outside. Is it harmful to try and treat your side effects or your symptoms before talking to your doctor? So maybe, not necessarily. I think that at the beginning, your team might be saying things like, if you have diarrhea, you can take some Imodium. So taking Imodium is probably going to be helpful and not harmful, but especially if they're recommendations specifically from your healthcare team. However, I would always call first. Reach out, like Sean, you're saying, it seems like with my chart or some type of email system is helpful. Just give your team a heads up and say, I'm getting some diarrhea, here it is, and this is what I'm doing about it. And like Sean was saying, that's probably going to result in a phone call from one of the nurses who's going to look more into it. And that will really, be helpful. It will help us know to keep an eye on it with you and make sure that you're on the right track, because sometimes it could be as simple as, taking something like Imodium, but sometimes it might be more concerning for something else that we need to be aware of and help see you through. So I would say, you can follow the recommendations from your team, but always kind of call first and see what's going on. Do you agree with that, Sean, as well?
I do.
Yeah.
And it's also, I just find it, excuse me, is a lot of times I'm like, hey, I've got this, I'm thinking about doing this. Is there something else? And by the way, if it's like been multiple times this has happened, I'm just like, hey, I assume that this is the right answer. And a lot of times they're like, yep, that's fine. And, or sometimes they'll call me and like, well, how is it? A lot of times it's just a good touch base. So, yeah, I mean, obviously at the end of the day, right. I want to make sure that I'm doing the right thing that's going to give me the best outcomes. And so, and I
Mhm.
think anybody who's going through this stuff is. And so a lot of times, I mean, these teams are great, right? They've done it for, lots of people before, and they've seen Dr. Finn, and often have some really good suggestions to help with some things. Like
Mhm.
my foot thing, like I probably wouldn't have come up that I should put preparation H on my sores on my feet, right? But they like, do this, it'll help, and it
Right.
does, right? Things like that, right? So
Mhm. Absolutely. Absolutely. One question from outside, are there any things that could affect if a side effect will happen or not, such as other medical conditions or medications, diet, etc.? Yeah, absolutely. So, every patient is different. We are aware generally of a side effect profile unless it's a brand new drug, but not everyone experiences them the same. So, like, for example, Sean, it seems like your blood pressure, reflux, hand, foot, a lot of people have those with the drug that you're on, and sometimes it's a lot more severe, sometimes it's not. And are there factors that could contribute to them? Yeah. So if you come in with a history of high blood pressure and we're giving you a medication that can cause blood pressure, you are going to be at, a high risk of, needing something to help optimize your blood pressure medication. So that is something that is important to discuss with your care team right from the get-go. Make sure they have your past medical history. Same thing with things like immunotherapy, for example. You might hear people say, do you have any history of autoimmune conditions? And it's really important, because if you do, that could potentially make it more likely that you would have problems with something like immunotherapy. So knowing your health history is certainly crucial, and your healthcare team can say, what impact, if any, they think that your other conditions may have on your ability to tolerate the treatment. Ways to prevent them, a lot of times optimizing health in general is helpful, but we kind of deal with it as it comes up, and we know a lot of things that we can do, like remedies, like preparation H and other things for people. So that's where coming into contact frequent and often is going to be critical. And if you don't feel like there's enough conversation in between visits, please, reach out and tell people on your team which methods you prefer, I'd say. You know, that is, being in more communication more often than not, I think, is always kind of the bottom line. And that's what I say to people who seem to be getting overwhelmed with all the side effects and things to do. I just want to reiterate, call me, call us, be in touch. Every drug, every treatment is going to have a whole list of side effects. A lot of them with the kidney cancer treatments are going to be similar from treatment to treatment. Some happen more often than not. Sean, is there one side effect that you seem to have that kind of stays with you more often than some of the others that you or anyone you've talked to that seems to be a consistent theme in your treatment?
Yeah, I mean, certainly the blood pressure is one that I think is going to be with me for a while. But again, all manageable, which is good news. Yeah, I mean, the reality is, I mean, I have, pretty on and off, again, diarrhea. But back to your point, it's like Imodium makes it so my life is, very manageable and stuff like that. But like that's pretty common, not all the time, but it's, relatively persistent and things like that. My reflux, I don't know, because I've taken Nexium and I didn't stop that because, gosh,
Yeah.
I feel terrible for people who live with reflux because it's awful. Like you can't sleep and things like that. So I constantly take that. I have not actually taken a break from that. I can imagine actually my team might say, let's see if it comes back. So I don't even know if I would have that because I just don't want to experience it. But yeah, but a few of them are pretty on again. But again, even the ones that are even like my diarrhea, it's like it's not every day, and it's so it's sometimes it's there and sometimes it's not. And often if I hold for a day or two, it might be fine for several days, right? Kind of thing. So
yeah. Definitely. I would agree. So things like the VEGF inhibitors, like drugs like Inlyta or cabozantinib, Sutent, they all have very similar side effects. I would think I see diarrhea, blood pressure changes, things like reflux and the hand foot. That's probably the most common things that we see from all of those drugs. And fortunately, because of that, we've become very good at managing them. So we can, we have the tools in our tool belt, so to speak, and we know what to expect, and we need to make sure that we're conveying that with patients like you, Sean, and knowing what to do, and telling people, maybe, here, look out for your blood pressure, maybe check it at home, be in touch, and know when to call if it's consistently over this. And yeah, that's just, it's so important. Now, I think another reason people sometimes say, I didn't want to tell you this because it's a little embarrassing, or people say quite often, I've never talked about my bowel movements, more in my life in a room full of strangers, basically, or all women. And that's true, but it's one of the most common side effects from a lot of our treatments. So we're very used to it. I always want to try to get that out in the get-go, like, listen, this is what we do. It's very common. It's very important that we know these things. Don't be embarrassed. Do you have any suggestions for patients who might be hesitant to relay such things because they don't feel comfortable sharing? Or is there anything we can do to create more of a safer space from your perspective?
Yeah. Yeah. I mean, it's not the funnest stuff to talk about, for sure. Right. But
Yeah.
I think in general, I think anytime cancer or any other tough diagnosis, I think you realize that you have to be incredibly transparent, right? Just the fact is, like, you're going through some stuff and you have a team and they can help you if you can share stuff. And so, I mean, we all probably have a bit of pride. You gotta get past that, I guess, and just like, all right, this is the thing. And, and so, but yeah, no, I think it is, I mean, to your point is, I think a lot of times those things are embarrassing, like in a regular world, but your medical team, that's what they do all the time, right? They're like, it's not embarrassing for that. And I think for me, at least, it was like, well, it's not hard for you to talk about. It shouldn't be hard for me to talk about, right? Kind of thing.
Yeah, that's a good perspective. Yeah.
This has been some wonderful discussion. As we're nearing the end here, I have sort of one last question I'm going to pose to each of you. So I want a quick rapid fire answer. What is one thing a patient can do, and what is one thing a provider can do to make a side effect discussion go better? So I'll go with Sean first.
Pick up the phone, send a note. Just as when you see something like, here's what's going on, can I, and just start the dialogue. That's what I would say.
Okay. Any advice for doctors on what they could do better?
I don't, like I said, I think my team is great and they've always been good there. If anything, they always offer, like, be in touch and we can do this, and they give good ideas and they help. I think as long as your doctor is saying, here's what you should expect, and you feel good that they're like, oh, by the way, we can help you with all of these side effects, especially as you're starting a new treatment. I think that's probably the scariest part for most people. Like, how bad could this be, or what am I going to get? And just understanding that so you're prepared, and then just being, once you do start it, being really transparent.
All right, Megara, one for doctors, one for patients.
For doctors in the healthcare team, I would say just be upfront with patients right away. Say, go over, it's a marathon, it's not a sprint. You may have to hold, you may have to do this, but please always tell us. We're here for you, we'll support you. And that reporting side effects, is so important. It shouldn't be embarrassing, but it also, doesn't mean that you'd have to stop treatment. There's so much we can do to help, and I just want to make patients aware and comfortable of that, and make sure that they have our contact information. And then from a patient perspective, I would say, please call, please reach out. If there are things that aren't going well, or things you think your team could do better, speak up, let us know. Everyone's different, and we want to be able to ensure that we're reaching you where you are. And everyone has different levels of health literacy and understanding, or having different resources at home, but we want to help you as an individual for sure. So just tell us what we can do better. Be in touch.
Great. And I do want to let people know that are listening, we are at the KCA working on a great quick handout for side effects, not only how to track them for yourself, but really, just reminding you that these are normal. Most people are going to have one, if not a few of these, and the best way to have those conversations with your doctor. So I want to thank our panel today, Megara and Sean. Thank you so much for the active discussion. We are going to take another 15-minute break. For those of you that are on the East Coast, grab a bite to eat. Those on the West Coast, time for a second cup of coffee. But we're going to circle back and we'll start at 11:30 with our next session. So thank you guys so much.
Okay, thanks. Bye.